Yes. Start off, we'll do the Pledge of Allegiance. Someone going to lead us? Go for it, young man.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you.
Thank you.
That went better than last time. I will move to adopt the agenda.
Second.
Mr. Pappas?
Yes.
Mr. Stone?
Yes.
Mr. Girth?
Yes. Presentations, a couple of them tonight. And I guess, let's see, we're starting with the harm reduction team. So, Mr. Commissioner Ingram, you're up.
Thank you. I think we have a few slides that we're going to pull up here. First of all, I want to thank the trustees and the Township Administrator for having us tonight. Of course, we work very closely with your staff day in and day out in the Township on different public health issues. And I'm not telling you anything new, but you've got a great staff and all the way across. And they're a pleasure to work with because they are just so professional.
Thank you.
And from my perspective, they do a great job. So tonight we want to talk about an issue that's that we can't seem to go by a day, whether it's during the work week or over the weekend, but not to talk about, and that is the scourge of opiate addiction we have going on in our community. And what I'd like to do tonight, if we could go ahead and advance the slides, and much, do I have the trick, or you got to? Yeah, that's okay. You can just. Okay, thank you. So I'm here tonight, and before I actually get into my presentation, I did want to introduce some folks that are with me. I have, to the far right, I have Craig Davison, who's Assistant Health Commissioner with Hamilton County Public Health, and he's over the Community Health Program. Next to him is Dr. Steve Fagan. Dr. Fagan has just recently been appointed Assistant Medical Officer for Hamilton County Public Health, so Steve has now joined our team. And also Dr. George Simulian, who's an infectious disease doc with the University of Cincinnati College of Medicine, and Dr. Simulian is one of the partners that is, and will be presenting to you shortly about the project I'm about to propose to you for your consideration. So what I would like to do tonight is talk a little about establishing a harm reduction program within Anderson Township. And what I'm going to go over is that it's founded in Ohio law. There's legal authorization. There's certain requirements that's specified in the Ohio Revised Code. I want to talk about the economic impact of what is going on because we are all fighting and facing this disease of opiate addiction. I'll review the partners that are part of the project. Dr. Simulian will talk a little about the existing Cincinnati Exchange project, which we are in the process of transforming into a public health project. The data is going to be covered by Dr. Steve Fagans, and he's going to give you kind of why we need to do this and why there's a sense of urgency. And we'll talk a little bit more about the core program services, and then I'll leave you with something relative to next steps for your action based on the consideration that you hear tonight. So in July 1st of 2015, the Ohio Legislature and the Governor signed into law Section 3707.57 Ohio Revised Code, allowing boards of health to establish blood-borne infectious disease prevention programs. There are certain requirements boards of health must do before they can establish such a program in a township, a village, or a city. One is we must consult with you as the decision-making body, and one way we would do that is not only to present to you tonight, answer your questions, but then at some point, preferably in June, ask you to adopt a formal resolution to do so. We have the authority to determine how the program operates, and again, the written notice of the local governing authority is kind of a moot point because we are here tonight to present to you and ask you to do so. It's a comprehensive public health harm reduction program to reduce the spread of communicable diseases. One thing that we have found in our community, and Dr. Steve Fagans and perhaps Dr. Simulian will talk about this a little bit, is that we're seeing a significant rise in the cases of hepatitis C, especially in the 25 to 34 age group, due to this disease of opiate addiction, as well as we're seeing a rise, although overall our rates of HIV are stable, we are seeing a rise now in the same age group with HIV, and many times, these two diseases coexist among this population. As a matter of fact, you might remember about 2 years ago, it was all over the news, about 2 hours from Cincinnati, the Scotts County, Indiana HIV outbreak that started because of, and this is a small community, the village seat or the county seat of Scotts County is Austin, Indiana. It's a community of around 4,200 people. The county itself is less than 30,000 people, so this is just a rural southeastern Indiana county in the Louisville metro market, media market. And back in November of 2014, there was a small group of folks that were fighting this disease of addiction. They were crushing some prescription drugs and then using them. And unfortunately, among this circle, one of them was HIV positive. And because they were sharing the equipment and so forth, before it was all said and done, there were 190 cases of HIV within about 9 months. And so it's a tragic story. About 85% of those folks are co-infected with hepatitis C. I don't have to tell you, men and women, what the impact of that is on those 25 to 34-year-olds for the most part, and how that's going to impact the rest of their life. As a matter of fact, it's just not that it's going to shorten their lives most likely as far as their life expectancy. The treatment costs and the economic impact to our community, to that society, is huge. With HIV costs rising between $400,000 to $600,000 for treatment costs, hepatitis C costs running around $100,000, and that's presuming that you've had the disease of addiction under control, where people are no longer utilizing those type of practices because there's no lifelong immunity given to you. Even once you've been treated with the drugs you're hearing about on the market for hepatitis C, if you continue the same unsafe practices, you can get reinfected. So we see about 140 new cases of HIV a year. I'm going to let Dr. Fagan talk a lot more about this. But what I just mentioned is that we've seen a pronounced increase in the 25 to 34 age group. As a matter of fact, in 5 years, it's doubled in that age group. We've also know that there's the cost that's associated with treating these diseases, and then there's all the other economic costs, either from the workplace standpoint, the loss of productivity, the inability to hire folks into the workplace, and just even those folks that are currently employed who have this disease of addiction, the lost work productivity, absenteeism, and so forth. There's a huge economic impact. And again, some of the folks end up incarcerated, and we don't have to say about how much that costs in our system. As a matter of fact, I was talking to some of our local county state representatives just this week, and one was informing me that the prisons, that state prison populations at an all-time high. We currently have 53,000 people incarcerated within just the state prison system. That's nothing to brag home about, obviously. I want you to know that we have many partners, and there will be more partners that will join us. I don't need to go through them. I also want to recognize your Township Administrator, Vicki Earhart, for her leadership. She has been participating actively with our local harm reduction committee that's made up of these folks and some others. I also want to let you know that Colerain Township has been meeting with us too, along with those groups under the leadership of Dan Malloy. It's a huge problem, and we all know that we certainly are not running from it. We're facing it, and we know what tools that we can implement to help abate some of the problems and the secondary infections that are associated. So I'm really here to ask you again to authorize by resolution, preferably at your June meeting, the operation of a comprehensive public health harm reduction program in partnership with Hamilton County Public Health, Cincinnati Health Department, the College of Medicine, Interact for Health, and these other partners. I would ask you that we would have Vicki Earhart continue to work with us in establishing this. And with that, I think I'll pause before I get into some of the operational aspects and introduce again Dr. Samulian, who will talk a little bit about the project he's been overseeing within a few of the neighborhoods of the city of Cincinnati. Dr. Samulian?
Do you have some information for anybody who would like to? Thank you, Commissioners. I'd also like to just mention, in addition to the data that Commissioners presented on future impacts with regards to health costs of hepatitis C, HIV treatment, one of the immediate costs that we see are bacterial infections. So Staph aureus being the most important bacterial infection, we see bloodstream infections and heart valve infections associated with this. In a study we've just published looking at it at University Hospital in a period from 2006 to 2009, and the increase from then based on 2016 dollars, we're looking at costing the healthcare system in this area about $140 million just at University Hospital for immediate 2016 dollars. If you spread that out over the rest of the county, let alone the future costs, which are in the billions, the immediate cost is substantial as well. I'd just like to tell you a little bit about the Cincinnati Exchange Project, which was... Oh, sorry, I have it. There we go. Cincinnati Exchange Project was started by one of my faculty members in 2014 with the authorization from Commissioner Ingram. I took it over last year, in August last year. We operate the Exchange Project under my supervision at 3 sites within Cincinnati and also in the city of Middletown. We operate a half day at 3 different sites within the city of Cincinnati. There's some of the data that are being presented here. We offer a comprehensive program of both provision of clean syringes, needles, works, alcohol swabs, cottons, etc. We provide counseling, hepatitis C testing at most of our sites, and HIV testing, and then overdose prevention, education, as well as the provision of naloxone when available, and then connecting people into treatment. We have a rate of about 10% connection to treatment, which is about double the national average. And what harm reduction programs do, such as this, is firstly, the concept of harm reduction in this environment is firstly providing for public safety, so getting needles off the street, getting needles out of parks, out of parking lots, etc., providing a safer environment for first responders if they respond to any drug-related activities. Secondly, keeping people healthy by providing them testing, counseling, etc., and then the ultimate goal of getting them into treatment. This is only a halfway house step in connecting them to treatment. It should never be seen as a means to an end. It's only a step along the way, and therefore has to be part of a comprehensive program. We are averaging about a 10% growth at the moment each month. We exchange, during the month of April, we exchanged 20,000 syringes at our sites in the city of Cincinnati and Hamilton. So we are having significant impact on the provision of clean supplies, getting dirty needles, etc., out of the community, and connecting people into care.
Dr. Steve Fagan is going to present some of the data that obviously is very persuasive, I think, and why we need to do something like this.
Thank you. I echo Commissioner Ingram's thank you and the opportunity to speak at my township trustees this evening. And some of this data that you see, we'll take a couple of slides to set the context for what we're talking about. You have seen this data because there is already an opiate task force in this township, and you have set opiate epidemic as a priority, and so you're already ahead of most places. What you see there is epicenter data, and so anytime there is an epidemic, there is data that feeds into an epicenter. You see 3 colors. The blue color would be 911 calls for accidental overdose. The red color would be emergency department visits in the Hamilton County, and the green are deaths. And so in 2016, there were a total of 3,550 ED visits and 3,671 911 dispatches. Already in 2016, there were a preliminary count of almost 299 overdose deaths, 84% of which involved heroin, fentanyl, or one of its analogs or a combination. You see a spike there, July, August, going into September, and that's when carfentanil was introduced into Southwest Ohio. Thankfully, you see some downward trends, but every day we see this. Every day we get a report that shows where the zip code of an overdose person lived. You've seen this before. This is 2016, so if you add all of those 3,500 overdose up, you see a heat map. The stronger the red, the higher the number. You see there's no part of Hamilton County that's spared, including the township and area in which we are standing now. And so it's an epidemic that affects basically all of us and all types of people as well. The two diseases that we'll talk about this evening, hepatitis C and HIV. Hepatitis C has made, unfortunately, a significant resurgence, tripled over the past 5 years. This is the CDC data, almost entirely, if not entirely, related to the epidemic of IV drug abuse. 34,000 new Hep C infections in 2015, highest number amongst the same demographic that is overdosing and dying of injection drug use, and 80% live more than 10 miles from an exchange program. Today, hepatitis C virus killed more than any other infectious disease, meningitis, pneumonia, any other infectious disease, and 20,000 HCV-related deaths in 2015. Looking at hepatitis C incidence, Commissioner Ingram mentioned the number of new cases. We have about 25 new cases of hepatitis C a week. You see the upward trend in the numbers per year, the last data available, 2016. It's the number one reportable disease aside from chlamydia and gonorrhea. The cases are split roughly equal between the city and the county residents. A pilot study by Hamilton County Public Health last year interviewing 80 new cases of hepatitis C found that 70% had a indicated history of injection drug use. And the shift of demographics, as mentioned, definitely in the 25 to 34-year range, which very much parallels the IV drug abuse. Unfortunately, similar to the opiate use disorder, we also see the same increase in pregnant mothers, which hepatitis C can be, in fact, transmitted to the baby. So HIV, this is the number of people living in Hamilton County with HIV. And so HIV is a chronic disease, and you live a long time if you're appropriately medicated. And so you see the accumulation of about 140 new cases. Hamilton County had the highest rate of new infections among all Ohio counties in 2015. And so the core services and needle exchange is not propagating an addiction, it's beginning the treatment. It's those folks who are reaching out to reduce harm, to begin the process of perhaps getting better and turning what would be overdoses into a person living with opiate use disorder. And so it's not just about exchanging needles, although it's an important part. It's about proper disposal, as mentioned. It's about testing for those types of diseases, HIV, hepatitis, other types of sexually transmitted diseases that can be treated. It's about overdose treatment with naloxone, getting that into the hands of those who can use it. We talk about that a lot. It's like giving a defibrillator to a heart patient. It's about vaccinations for other things that can be vaccinated and enrollment into healthcare coverage, as well as counseling and education, and for those who are ready, connecting to care with peer navigators and others. And so it's not just about needles, it's about care coordination and a comprehensive harm reduction that starts somewhere and can very well start with a needle exchange. And so I would hand off to Commissioner Ingram to continue that discussion.
I did want to point out that I saw one of our partners join us, and there might be more, but I wanted to recognize Kelly Fire Chiefs from Interact for Health, who has been very instrumental into getting us to this point, because they have been helping fund part of this process. So I guess I would just leave you with this. Does somebody have the clicker? Good, thank you. These are the core services, and you can see it's a comprehensive program, but I see this as an opportunity, as a gateway into medical assisted treatment. I see this as an opportunity to get people hooked up with the resources that begins to treat this disease of addiction, not only to begin to go through withdrawal management, but also treat the parts of the brain that have been impacted due to the use of these opiates over time, whether it's heroin, carfentanil, fentanyl, or prescription opiates. So I really want you to, that is really the big focus is here, is to prevent these secondary infections and do testing and vaccinations where appropriate, but it's really about, it's a gateway into treatment. So the next steps would be for the township, the Board of Township Trustees from Anderson Township to authorize the operation of a program in their township. I want you to know that we're looking at a mobile site. We're not looking at a fixed site. I would ask you, I'm not expecting you to do anything tonight, obviously. You're hearing this for the first time. We would like to continue to work with Administrator Vicki Earhart as we work out some more of the details and answer some of your questions. I'm available to you anytime, as you know, as your health commissioner. But I would love to be able to come back here at some point in June and at least hopefully have a resolution in hand, because it will take us a few months to get it up and running. As I said earlier, we are kind of going through some transformation with some of our partners as far as making it more of a public health project, and it'll be much more generic in that regard. But we have great talent and resources available to us, and I know that none of these decisions are ever easy, but if you look at the economic consequences to just the employers in our community, as well as the costs, the societal costs, not counting how it is just tearing the families apart, because we all know somebody, and we're all vulnerable. And we can't run from it. We can't hide it in the closet, folks. We have to face this monster and do our very best to get our arms around it and wrestle it to the ground. And this is one tool that will help us get there. It's a proven practice. It's best practice. The evidence is clear. This would be the right thing to do. Thank you for listening to us tonight.
One question, if I might. Your facilities at these that you've set up currently, you said you had a 10% that they take the next step if they come there, that 1 out of 10 go down the road of
Connect to treatment.
Connect to treatment or no?
Dr. Smullian,
Yeah, he said
I'll let
connect
you
to
answer
treatment,
that.
10%.
Go ahead.
Yeah, so that's data that we've collected from 2014 through to the beginning of 2016. About 10% of our clients have connected into treatment and there's very little data on successful
That's fine,
things.
but they've taken that next step other than
Correct.
just showing up.
And you
Yeah.
said that was double the national average.
That's about double the national average for syringe exchanges programs elsewhere.
Thank you.
I did want to recognize, because there are a lot of people who have come out to support, and I now saw you, Township Administrator Dan Malloy is here. Dan, thank you for being here with us tonight, another valued partner, and Dr. Marilyn Crumpton, the City of Cincinnati Health Commissioner, is here with us tonight. We are all in this together, folks.
Oh, yeah.
Again, we look for your favorable reply. Thank you.
Thanks, Tim.
Thank you.
Thank you all for coming.
Yes, thank you. That was a good presentation.
Speaking of presentation, Chief?
Good evening. Tonight, we bring to the board promotional recommendations. We have a vacancy in our lieutenant ranks, and we'd like to present to the board firefighter Dan Dacey, who's been on our department since 2001 and has diligently worked through promotional processes to make it where he's at. He's an excellent employee. And with that said, at this time, I'd like to, if the board would carry on with the motion,
Dan, you got
Oh, that's
this.
me.
to be so kind.
Sorry.
She'll get there.
This one, right? I move to authorize the Fire and Rescue Department to promote firefighter paramedic Dan Dacey to lieutenant effective May 18th, 2017.
Second. Yes.
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 At this time, Dan, if you would come up, our fiscal officer, Ken Dietz will do the swearing in.
Not yet, not yet.
You will raise your right hand and repeat the oath of office after me. I, please state your name.
Dan Dacey,
Do hereby swear
do hereby swear
to uphold the Constitution of the United States,
to uphold the Constitution of the United States,
the Constitution of the State of Ohio,
the Constitution of the State of Ohio,
policies and procedures
the policy and procedures
of the Board of Township Trustees
of the Board of Township Trustees
of Anderson Township,
of Anderson Township,
and to ethically and faithfully
and to ethically and faithfully
discharge the duties of my office.
discharge the duties of my office.
Okay, right up front, if you would. Tiffany, would you like to come up, Dan's wife, and pin the badge on, please? Thank you.
And there they go.
You have quite the fan club. Who are these other people with you? Well, I was watching.
And children, and they were very well behaved.
Is this parents right here? I can tell. The mom was tearing up. I'm like, oh,
Hey, it's time
congratulations.
Congratulations, time for a celebration. Just know where you'll be. Yeah, there you go. Mix it up.
Keep up the good work.
Thank you. Thanks for
And
coming.
with that, we had a, hey guys, thanks for coming. We have to stay. Let us know where you'll be. We'll catch up with you later. And then there were two. Oh my God. Was it something I said?
Yep.
Nice. Maybe we should do that at the end of the meeting? Suggestion?
All right, public forum. Anybody wish to address this board? Going once? Trustee comments.
You want to start with me?
Trustee Pappas?
I would just like to say how absolutely excited I am this weekend. The Beachmont and 5 Mile interchange goes live. Steve, what time is that at?
Time after 11 o'clock tomorrow.
Is there an exact time? So, I just want to say I'm giddy. And I can't wait to be out there.
Will you be the first?
I might. That's why I was trying to see what time it would be. Steve, could we narrow it down to a little bit, a window maybe, between 11:30?
Focus before sunrise.
Oh. See, our confidence level has gone up. I'll bring the duct tape, but no, I'm just excited to see this new interchange work, and I can't wait to see it. Actually, no, I really am. I know it's been a pain for staff, and I've received a few phone calls, maybe one or two about it, so I am actually excited to see it come to fruition and be done, and the improved flow will be much anticipated. So, thank you.
I'd like to,
I can hear you.
I'd like to thank you. I'd also like to note that those calls probably won't stop.
Oh, no, they're
So
good.
appreciate your patience and understanding in advance, and we'll continue to work through this in the weeks to come.
Everyone can call Josh if they have any comments.
No problem.
I'm done with, that's the end of my comments.
That was amazing, by the
It
way.
was
Thank you,
amazing.
Andrew.
You're welcome.
I just want to make a comment on the presentation we just heard from
Commissioner?
Commissioner Ingram. I don't know. I just thought it was a well-done presentation. I know we have to discuss it, but this is a big issue, and I just feel like things need to be done. And I thought they did a great presentation. I hope people will just look into what's being done on the Cincinnati Exchange project. Apparently, there's a Facebook page, and you can go to cincyep.org. At least that's the sheet they gave us. So the economic impact that the Hep C epidemic is having on our region is just astounding. So there's steps that need to be taken, and I appreciate them for coming in talking to us about it so we can look into it and see what we want to do. So, and that and the continuous flow intersection, that's a big one coming up. And also just want to talk, the garden tours coming up on June 4th. There's a lot of community residents that put a lot of time and effort into their gardens. And I took the tour, I went to every single garden last year. I think there were 10 of them last year. I'm not even sure how many there are. Paul, do you know? 9 this year. They're beautiful. If you get a chance, it's a wonderful Sunday afternoon thing to do. So I would encourage.
When is that?
It is Sunday, June 4th. I would encourage people to go and visit the gardens.
So we have some time.
Field
We have
trip.
some time. We have some time, but this won't be on TV till after, so.
Oh, wait,
We're on TV now.
wait, can I back up a second? Can I say something else?
Yes.
This weekend, Saturday, we are meeting, Richard, Saturday, what time are we meeting? Is the cemetery,
If we're talking about Hillcrest.
we are,
Hillcrest Cemetery, the Coalition to Save Hillcrest Cemetery members, one of our board members, Todd Mayer, has organized a group of volunteers from GE, which he does every quarter. And he also has a number of volunteers, including Boy Scout groups and other groups that are going to be assisting with a cleanup at the cemetery from 8 to 12:30 this Saturday. They're primarily working on scrubbing the headstones. They're also going to be picking up some tree limbs and some other debris. But that, like I said, it's an effort that is truly beneficial that one of our coalition board members has organized through GE, in addition to the work that American Legion Post 318 has done there periodically. So it is helpful for that cemetery.
I wanted to put that out there again, and then I will be there as well for a period of time, as long as I can, to help out. I think it's a worthwhile cause. If anyone has the time to volunteer and give back a little bit, I think it's a great cause.
Yes, and the parking for that, because the parking at the cemetery is very limited, and the people that come to the cemetery are strongly encouraged to stay on the pavement, on the roadway. There are graves right up next to the roadway that are unmarked, and parking on those would be very dangerous. So parking is graciously provided by Coney Island at the corner of Kellogg and Sutton, and all vehicles must be removed before 1 o'clock from that parking lot.
Should put that on Help a Neighbor.
I was going to. I thought I did, but I will. But anyway, thank you, Vicki.
Very good. Anyone else? Ken, anything to say, except for the money report?
Yes, we have a small report. The financial reports indicate that the revenues are coming in after 4 months, the end of April. They're almost what we anticipated for the first 6 months, but then, of course, we got the real estate collections in, and they're finalized. And usually there's a lot more delinquencies in the first half settlement reports, which there were, and that's the reason the TIF monies that are going to the schools are, actually the schools are going to get close to $5.4 million. I told the treasurer don't expect that the second half because we did have quite a bit of delinquencies that came in, and they won't come in at that level in the second half. So revenues are looking good. Appropriations were slightly down on the anticipated revenues, but we have bills to pay, so they will catch up. But we're looking like we're going to at least have our usual 5 to 10% expenses under budget at the end of the year. So those reports are available. We have one appropriation change. We did have some election charges for the public safety levy last year. It's an independent line item, and I did not appropriate any money in that line item. So we would like your approval to transfer $6,000 from miscellaneous expenses to election expenses so that we can make that payment.
I move to adopt the appropriation changes as presented by Fiscal Officer Ken Dietz.
Second?
Mr. Pappas?
Yes.
Mrs. Stone?
Yes.
Mr. Girth?
Yes.
Thank you.
Thanks, Ken.
Margaret? Thank you. Paul? All right. Yay. Lieutenant Guy?
Good evening. There's just one very brief item on the agenda for the board to consider. It's a liquor license request. It's a new request for CFFM Incorporated, doing business as the Country Fresh Farm Market located at 8315 Beachmont Avenue, Suite 15, I'm sorry. And we have no objections to the physical location of this.
Didn't they sell liquor already, or no?
Yeah, they did.
Small 4 ounce.
What?
They were less than 4 ounces. They were tastings. It's in here. Yeah, now they want to serve bigger,
Yes.
more than 4 ounces, apparently.
Okay. I move not to object to a new liquor license request for CFFM Inc. DBA Country Fresh Farm Market located at 8315 Beachmont Avenue, Suite 15.
Second.
Mr. Pappas?
Yes.
Mrs. Stone?
Yes.
Mr. Gerth?
Yes.
I think it was, they had a carryout license, and then they, like you said, they had a license for small samplings and tastings that are very kind of restricted, and this is an expansion upon that.
Thank you.
Thanks, Matt. Richard Shelley.
Good evening. I have just 2 items before the board tonight. The first one is our annual accept the bids for paving. This year on a paving program, I will point out to the board that not only did we have favorable results, but what we did this year was a little bit unique. As the board is aware, we were awarded a grant opportunity, which turned out to be a loan for one of our subdivisions. The Ohio Public Works Commission made a offer to us to borrow some money, and we decided to do that this year. Well, the money doesn't become available until the middle of June, so it was important to not put that program, which is a smaller paving program, out by itself. The numbers would not have been as favorable. So we actually held our normal program, which is all the streets in some of the states, back 1 month and moved the other one forward, coupled them together, and what you see is the results of that. We were published and on the street at a bid amount of $1.3 million, and what you have before you is an option to accept the Jurgensen Company at $1,067,000, $952.50, almost $240,000 under budget.
There's a big, I mean, these bids are kind of spread. He really...
The third bidder in that game is brand new.
Okay.
We're not really sure, we're glad there's a third bidder. We would love a fourth and a fifth bidder.
Yeah.
But the truth is, that's a new bidder. Typically, it's just Barrett and Jurgensen in that game. So, but what you have there before you, it all depends on their workload at this moment.
Yeah, he must
So
be.
we just must have caught the right timing. But we did gain economy of scale, lumping both subdivisions together, and the results are shown.
Yeah, that's great.
I move that this board hereby accepts the bid of $1,067,952.50 from John R. Jurgensen Company, deemed to be the most responsible bidder for the 2017 street rehab program project in accordance with the bid plans and specifications, together with a 10% contingency for maximum appropriation of $1,174,747.50 in 1994 TIF funds. Further, this board hereby authorizes and directs the township administrator to give timely notice of award to the contractor, and after consultation with the law director, to enter into contract with John R. Jurgensen Company in accordance with their bid for the 2017 street rehab program project. Thank you.
That was
I'm sorry. What did you say?
I'll second that.
Mr. Pappas?
Yes.
Mrs. Stone?
Yes.
Mr. Gerth?
Yes.
Can we round up? Let's just round up next
Oh,
time.
no, we don't round up to anything.
Can't
round up on
No. Can we scratch that from the record, please?
We do not
Feel
round
my
up.
gaze upon you while you were...
The second item I have before the board is there are no attachments in your packet, but this is just somewhat of an announcement. May 21st and May 27th is the National Public Works Week. It's that time of year. Every year in May, we celebrate the guys in Public Works. For all the, I guess, lip they take the rest of the year about traffic tie-ups and construction, and but obviously this board has shared many times the level of gratitude they are for our staff, but this is a time once a year where we make it official, and we thank them publicly and tell them they're doing a good job for the year and to keep it up.
Are we doing something? or-
No, we do have something?
We do not. I was
Okay,
just
we're
going to add to this that I think this is an important time of the year to remind residents and motorists to be very careful in construction zones. There have a number of fatalities associated with road maintenance crews, public workers throughout the state of Ohio, especially on the interstates. And, you know, the orange barrels, we all complain about them and we joke about them and some of us dress like them sometimes. You know, they're there for a reason. The reduced speed limits in those zones are there for a reason. And it's to protect the road crews in addition to first responders that may be out there. But I think this is a good time to remember that.
Thank you, Vicki.
I'm gonna miss the lane blockages on Beachmont. I really will. Joy.
Thank you.
Thank you, Richard.
Give me a time.
Chief,
Big switch we throw?
thank you.
Big light switch?
Last but not least,
What does that mean?
Actually, Mr. Severs has the first item.
Don't worry, there'll be more barrels on Beachmont this summer. They'll just be moving down the street. I have one item for your consideration, and this is a proposal that we have been working with the county engineer's office on regarding Kellogg Road. The proposal essentially involves the township providing funding for the resurfacing of Kellogg from Sutton Road to 5 Mile Road and possibly east to US 52 interchange. In exchange with that, the county engineer's office would be investing in pavement on 5 different township roadways, portions of Clough Pike, 8 Mile Road, 5 Mile Road, State Road, and Turpin Lane. The funds that we're looking to allocate for this project would come from the riverfront TIF area, which were generated by Belterra Park's redevelopment. So in essence, we would be putting those funds right back at the front door of Belterra Park to service that area for years to come. So if there's any questions, I'm happy to answer those. Otherwise, there's a motion for your consideration.
Any questions? I move to authorize the expenditure of up to $1 million in riverfront area TIF funds to assist the Hamilton County Engineers Office with resurfacing of Kellogg Road from Sutton Road to US 52 ramps, provided the county is committed to other resurfacing projects, including portions of Clough Pike, State Road, 5 Mile Road, Turpin Lane, and 8 Mile Road as outlined by staff.
Second.
Mr. Pappas?
Yes.
Mrs. Stone?
Yes.
Mr. Girth?
yes.
Thank you, and I speak for those 3 primary businesses that are down there, and they thank you as well. They're very excited about this. And I also want to thank Matt. We've been working tomorrow. Saturday is D-Day for the new Riverbend exit proposal, so we'll see how that all works. We did put a YouTube video together. It's on our website and Facebook page. We're excited, but it will have some changes, including the use of Sutton Road and Salem Road to get pickup traffic out of there. Tony's exit, I think, is fully paved as of 4 o'clock this afternoon, so once we test the CFI on Friday night, we'll test this on Saturday night, so.
Wow, big weekend.
Yeah.
Long weekend. What time Friday night?
I'll do this one.
There are just a couple of items. The next is a resolution that is before the board arising from executive session discussions, which would reappoint the township administrator.
Oh.
Oh.
Well, I will take this one because I am more than happy to do this. I move to adopt a resolution reappointing our township administrator, Ms. Vicki Earhart.
Second.
Mr. Pappas?
Yes.
Mrs. Stone?
Yes.
Mr. Girth?
Yes.
Thank you very much.
Thank you,
You're
Vicki.
very welcome.
Thank you. Now that I've said that, I do have one error to correct on the agenda.
Oh, great.
The next regular monthly board meeting should read June 22nd, and for your announcement. And I would also request that the board retire to executive session to consider the sale of property as permitted by Ohio Revised Code Section 121.22G2.
So moved.
Second.
Mr. Pappas?
Yes.
Mrs. Stone?
Yes.
Mr. Girth?
Yes.
Thank you.
Thank you.
Thank you.